North Lincolnshire Council's Children and Young People Service is responsible for providing services to children, young people and their families in North Lincolnshire, including child protection. The service has developed close, open working relationships with other agencies, including the North Lincolnshire and Goole Hospitals NHS Foundation Trust. We interviewed Dave Basker, Principal Social Worker Safeguarding Practice, who, as well as having overall responsibility for workforce development throughout children's services, chairs a multi-agency moderating panel, encouraging closer working relationships between agencies. We asked Dave, Service Manager Di Rees from the Referral Assessment and Child Protection Team, Craig Ferris, Head of Safeguarding for North Lincolnshire and Goole Hospitals NHS Foundation Trust, and Paul Welton, Detective Inspector for a Public Protection Team in Humberside Police, to describe how children's services, the Acute Trust and other agencies work together to ensure children and families' best interests are served.
We have a very good working relationship with the safeguarding nurses from the Trust.
The best thing about working across the Trust and the local authority is the fact that actually we can have discussions about cases, and it's not necessarily we will refer and they will pick up a case. We will have discussions around making a referral and whether they will pick it up and how it's best to be handled. It's very much a partnership arrangement as opposed to them and us type relationship. We obviously identify cases of abuse or alleged abuse within the Trust through accident and emergency departments and through our health visiting services, etc. And would make sort of the appropriate referral across to the local authority. We also have the other passage of information. Actually, referrals will come into the local authority and then they'll consult with us for advice and support around perhaps medical examinations or seeking further information that we may hold within the Trust.
It may be that a child will turn up at school, so education may be involved and they may report to us that they have concerns about children, or indeed somebody may ring the police. In every case where there's any intelligence that comes in that says there's a child who's been maltreated, then we will record that and then have an interagency discussion about what we all know and what further action we should take.
At the point that we get the referral, we will not know whether a child needs a child protection plan or not. Our role as the social work team, along with other professionals from health, from the police, from education, the assessment process will really be what decides whether or not that child needs to be subject to a child protection plan. And if it's decided that there's enough significant harm to need a child protection plan, we will obviously take it to a multi-agency case conference.
People come together naturally now. It's been obviously a system that's been in place for many years, both locally and nationally, where the core group of professionals are very key in determining what needs of the child and the family should be serviced.
Levels of communication are extremely important, and I think in North Lincolnshire that's one of our great strengths.
We do have good communication at different levels, both at front door type communication and through to sort of middle and senior management. And that's not in a controversial, confrontational kind of way. That's in a partnership, helpful, let's discuss cases type way.
I think it's around communication and relationships. We have very clear systems between ourselves and the hospital, for example. We share information daily, really. If a referral comes in either to A&E or to ourselves, we have that cross-referencing of information, a link into us if the hospital needs to know whether a child, say, is subject to a child protection plan, for example, whether or not we've had any previous involvement. And we have regular liaison multi-agency meetings with the safeguarding nurses from the hospital, and with the practitioners, with the midwives and the health visitors. Ourselves in duty have gone into the hospital to do joint training, and following on from that we've developed very regular practice forums for our staff and health staff, where practitioners will meet together with managers. We may discuss a particular case that's raised a particular practice or training issue, or there may be a theme, and we will do sort of joint training and practice discussions about that. And we use that to randomly quality assure and audit referrals that have come through to us from those agencies over the last 3 or 4 weeks. And we will look at in detail at the referral, when the referral was made, how it was responded to, and it's very much done live on the electronic system.
We have a multi-agency moderating panel, which is a panel of managers who come together with representatives from a whole range of health services, including the Acute Trust. And we will look at individual cases. So that type of working at a very strategic management level, I think is quite unique, and it's very effective in encouraging closer working relationships, trust, and clarity about our roles and responsibilities.
We have good feedback about whether our referrals are of a good quality or of a poor quality, and that's not about waiting 3 months and auditing. That's a live quality assurance process. So if we made a referral today that doesn't meet a standard, we'll have a phone call. My team would follow that referral up, have a look at, does it meet a good quality standard? If not, why not?
Most importantly, we randomly select cases for audit and we compare each other's notes, make sure they're the same. So we've always got a record of any disagreements, any conflict, leading up to us agreeing on the best course of action.
We have a whole range of multi-agency training around identification of child maltreatment and also how we intervene with that. So on a training level and development level, there's lots of learning and sharing of information.
I think the biggest challenge that we face within sort of the Northern Lincolnshire Trust is that the size of the trust. We have, like most large hospital trusts, we have a lot of staff, and I think trying to have an amount of staff of approximately 7,500 all trained to the right level at the right time scales, and also working across the 3 local authority boundaries, that brings us challenges.
And I guess one of the biggest challenges over the past 3 years has been making sure we consistently listen to what children, our most vulnerable children, have to say, and how we act on that and how we put it within a planning process to improve our services. Establishing that group of young people who are, I think, a very effective consultation group for us, it's been a real challenge, but a challenge that I think everybody has risen to. And it's taken a lot of work on a multi-agency basis to make sure that the right things are in place, to get the right information from the children and young people so that we can all look at where we can improve our services. And we work very hard to look at not just making sure the right systems are in place and the right processes, but also the things about professional knowledge and professional expertise and judgment, and make the learning a pleasure and make the learning something that we should really enjoy. And working in social work, particularly in North Lincolnshire, I can say that the beginning from being a qualified social worker through to wherever you want to go is a journey of learning and making sure that we become expert at what we need to be expert at, and that's about knowing what works with families in terms of interventions, what works with families in terms of listening to children, and also what works with families in terms of how we need to gear up our services and respond to their needs.